It wasn't the life I had pictured for me, my daughter, Stephen, my family. I had a mass that was the size of a football connected to my left ovary. It was the day of our Christmas party. And so I would say the night before, I ended up in severe pain. I had no idea what was going on. So I kind of let it lie, took some Advil, just waited through the night. And then the next day, I decided when I couldn't, excuse me, I couldn't step on my left leg because I was in so much pain. So what we did was I went to the emergency room in, I probably shouldn't say the hospital, but I went to the emergency room and they diagnosed me with kidney stones. So we thought I just had kidney stones. And so I went to my doctor a couple days later, probably a week later, just as a follow-up as well, because I had been referred to her. And they felt the bump. And then they did ultrasound. I had a mass that was the size of a football connected to my left ovary. So what they did was they automatically referred me over to Dr. Hope, and I met with her within that week. And then I would say it was about a week later, I had my surgery. At that point, we didn't quite know if it was cancerous or if it was going to be just, you take the tumor out, you take the ovary, and be done with it. When I woke up, I think my mom was there in recovery. They had let her back into recovery. And she told me that they had found cancer. And so therefore they had to do a full hysterectomy. So then from that point, what we did is we watched my CA 125 level. And it was elevated at that point prior to surgery as well as right after surgery, but it decreased seemingly shortly after surgery. So I was kind of in the clear for a while. In between that time, I had close to 2 years. And then I ended up in the hospital with, I can't remember if it was a kidney or a bladder infection that was somewhat antibiotic resistant. So Dr. Hope and her team decided to put me in Providence to be treated with IV antibiotics. And at that point in time, she just kind of thought, let's play it safe. Let's do a CAT scan, see what we can see, just to make sure there was nothing growing on the, kidney or liver. The CT just managed to catch a portion of my lungs, and he noticed that there was something on my lungs, like nodules possibly, but they didn't quite get the full lung, photo. So therefore they had to send me back down to CT to get a lung CAT scan. Dr. Hope came in a little bit later and talked to me. And they had found my cancer had spread. It had actually come back and it had spread to my lungs. So it had metastasized to my lungs and I had 18 nodules throughout both lungs. I went in for a lung biopsy so they could biopsy one of the nodules to see if it was the mucinose that I had on my ovary. And indeed it was. We found out the nodules in my lungs were indeed cancerous, so we would have to do chemotherapy. We would most likely start chemotherapy right away. So I've gone through, since that point, I've done several different chemotherapy concoctions, I would call them, immunotherapy. I've had cyberknife radiation, and we are just kind of continuing on, and I'm still doing chemo right now. I just do it every 3 weeks. I feel like a lot of people, when they're young, they maybe don't notice the things that they typically would as they get older and get to know their body a little bit better. It may sound weird, but I mean, even just your physical feeling or emotional feeling, when you're younger, you don't necessarily know that. Keep up with your regular routines of going to the doctor, have your pap smears and, get your blood work done. I mean, I kind of advocate that to everybody. Don't hesitate. Don't wait to see if it gets worse. I try and promote that to girlfriends. And I've had some girlfriends who have had not similar experiences, but have found that they also have had, problems. live life to the absolute fullest. Don't hesitate. If you have things that you want to do them. Get them done. It just kind of changed my view on life, I guess, how fragile it is.